If you're over 50 and you've ever been standing in line at the grocery store, or maybe cooking dinner in the kitchen, or just chatting with friends at a gathering, and suddenly that familiar ache starts creeping into your lower back, I want you to know you're not alone. This is one of the most common complaints I hear from people in their 50s, 60s, 70s, and beyond. That dull, nagging pain that seems to get worse the longer you're on your feet can really put a damper on your day. But here's the good news. There are some simple, practical things you can start doing today that may help you stand more comfortably and reduce that discomfort. Today, I'll walk you through 4 key strategies step by step, and I'll give you easier options along the way if you need them. Hello, my friend, and welcome back. I'm Dr. Sarah Truman, and I'm so glad you're here with me today. Before we dive in, I want to be very clear about something important. I'm a health coach and wellness educator. I am not a medical doctor, and this video is not medical advice. Everything I share today is for general educational purposes only. Please talk to your own doctor or healthcare provider before starting any new exercise, changing your diet, or trying any supplement, especially if you have any health conditions or take medications. Your doctor knows your personal situation best, and nothing I say here replaces their guidance. I really want you to feel safe and supported, so please keep that in mind as we go through today's information together. Now, let's talk about what we're covering today. Lower back pain from standing too long is incredibly common, especially as we get older. It can make simple, everyday activities feel exhausting. Standing to cook a meal, waiting in line, attending a grandchild's school event, or just walking around at a museum can become uncomfortable or even painful. The good news is that this type of discomfort often responds well to simple lifestyle adjustments and gentle movement practices. Here's what we'll cover today. First, I'll explain why this happens, what's actually going on in your body when your lower back starts to ache from standing. Then I'll share 4 practical strategies that may help. We'll talk about improving your standing posture and making small adjustments to how you hold your body. Next, we'll go through some gentle stretches you can do daily to release tension in the muscles that contribute to this pain. Then I'll show you some simple strengthening exercises that may help support your lower back over time. And finally, we'll talk about your environment, things like footwear and the surfaces you stand on. After that, I'll cover some common mistakes and myths, and I'll also let you know when it's really important to see a doctor. Does that sound good? Let's get started. So why does this happen? Why does standing for extended periods cause lower back pain, especially as we get older? Let me explain this in simple terms. When you stand, your spine has to support the weight of your entire upper body. Your lower back, which we sometimes call the lumbar spine, does a lot of that heavy lifting. It has to maintain a slight natural curve while keeping you balanced and upright. Now, when you're younger, the muscles, ligaments, and discs in your spine tend to be more resilient. They can handle standing for longer periods without too much trouble. But as we age, several things start to change. First, the discs between your vertebrae, those little cushions that act like shock absorbers, begin to lose some of their water content. They become a bit thinner and less spongy. This means they don't absorb pressure quite as well as they used to. Second, the muscles that support your spine may weaken over time, especially if we're not as active as we once were. When those muscles get tired, your spine has to work harder to keep you upright, and that can lead to strain and discomfort. Third, the joints in your spine, like all joints in your body, can experience some wear and tear over the years. This is completely normal, but it can make standing for long periods less comfortable. There's another piece to this puzzle, and it has to do with posture. When we stand for a while, especially when we're tired or distracted, we tend to shift into postures that aren't ideal for our backs. Maybe we lock our knees, or we let our pelvis tilt too far forward, or we slump through our shoulders. These little habits can put extra stress on the lower back without us even realizing it. I want you to know that this is very common. You are not alone in experiencing this. And the good news is that small changes can often make a noticeable difference. You have more control over this than you might think. So let's get into the practical strategies. The first thing that may help is becoming more aware of your standing posture and making some gentle adjustments. I know that might sound simple, But the way you hold your body when you stand has a big impact on how your lower back feels. Many of us have developed habits over the years that we don't even notice anymore, but those habits can contribute to discomfort. Here's what I'd like you to try. First, stand with your feet about hip width apart, not too close together and not too wide. Just a comfortable, stable stance. Let your weight be evenly distributed between both feet. A lot of people tend to shift their weight to one side, and that puts uneven stress on the spine. Next, think about unlocking your knees. When we lock our knees, pushing them all the way back, it tends to tilt the pelvis forward and increase the curve in the lower back. Instead, keep a very slight bend in your knees, almost like they're soft and relaxed. It's a small change, but it can take a lot of pressure off your lower back. Now, imagine there's a string attached to the top of your head, gently pulling you upward toward the ceiling. This helps lengthen your spine naturally without straining. Let your shoulders drop down and back away from your ears, and try to keep your chin level, not jutting forward. Here's another tip that many people find helpful. Gently engage your core muscles just a little bit. I'm not talking about sucking in your stomach or holding your breath. Just think about drawing your belly button slightly toward your spine. This activates the deep muscles that help stabilize your lower back. Now, here's something really important. Don't try to stand perfectly still like a statue. That actually makes back pain worse for most people. Instead, shift your weight from one foot to the other occasionally. March gently in place if you can. Take small steps. Movement is your friend. If you have trouble with balance, please feel free to stand near a wall or a countertop for support while you practice this. And if any of these adjustments cause pain, stop immediately and just do what feels comfortable for your body. Everyone is different, and what works for one person may not work for another. Take your time with this. There's no rush. Now let's move on to something else that can help, and that's gentle stretching. Tight muscles are a major contributor to lower back pain from standing, and there are a few key areas we want to focus on. The muscles in the front of your hips, called the hip flexors, tend to get tight from sitting, and then when you stand, they can pull on your lower back. The muscles in your lower back itself can also become tense and overworked. And tight hamstrings, the muscles in the back of your thighs, can affect how your pelvis sits and contribute to back discomfort. Let me walk you through a few simple stretches you can try. Please remember, these should feel like gentle pulls, never sharp pain. And please check with your doctor before trying these, especially if you have any hip, knee, or back conditions. The first stretch is for your hip flexors. You can do this standing near a wall or sturdy chair for support. Take a step forward with your right foot, keeping your left foot back. Gently bend your right knee and let your left hip move forward slightly. You should feel a gentle stretch in the front of your left hip. Hold this for about 20 to 30 seconds, breathing slowly and deeply. Then switch sides. If getting into this position is difficult, you can also do this stretch while lying on your back on a bed, letting one leg hang gently off the side. The second stretch is a gentle seated forward fold for your hamstrings. Sit on the edge of a sturdy chair with one leg extended straight out in front of you, heel on the floor. Keep your other foot flat on the floor. Sit up tall and then gently lean forward from your hips, reaching toward your toes. You don't need to touch your toes. Just go until you feel a gentle stretch in the back of your thigh. Hold for 20 to 30 seconds, then switch legs. The third stretch is a simple lower back release. You can do this lying on your back on a bed or on the floor if you can get down safely. Bring both knees toward your chest and gently hold them with your hands. Rock side to side very gently, almost like you're giving your lower back a little massage. This can help release tension in the muscles along your spine. Do this for about 30 seconds to a minute. If any of these stretches cause pain, please stop immediately. And if you have had hip replacements or any spinal conditions, please check with your doctor before trying these movements. Listen to your body. Even a small stretch done gently can make a difference over time. You don't need to push yourself. All right, here's another thing that often helps, and that's building up some strength in the muscles that support your lower back. Now, I want to be clear, we're not talking about anything intense or strenuous here. We're talking about gentle exercises that may help your core and back muscles become a bit more resilient over time. Stronger muscles can help support your spine so it doesn't have to work so hard when you're standing. Let me share a few simple exercises you might try. Again, please consult your doctor before starting any new exercise, especially if you have any health conditions. The first exercise is called a pelvic tilt. You can do this lying on your back with your knees bent and feet flat on the floor or on a bed. Place your hands on your hip bones. Now, gently flatten your lower back against the surface by tilting your pelvis slightly upward. It's a very small movement. Hold for a few seconds, then relax. Try to do this 5 to 10 times if comfortable. This helps activate the deep core muscles that support your lower back. The second exercise is a gentle bridge. Starting in the same position, lying on your back with knees bent, slowly lift your hips off the surface just a few inches. You're not trying to go high, just enough to engage your glutes and lower back muscles. Hold for a few seconds, then slowly lower back down. Try 5 to 10 repetitions if that feels okay. If you feel any sharp pain in your back, stop immediately and skip this exercise. The third exercise is called bird dog, and it's done on your hands and knees. If getting on the floor is difficult for you, you can skip this one or ask your doctor about modifications. From your hands and knees, with your back flat like a tabletop, slowly extend your right arm forward and your left leg back. Hold for a few seconds, keeping your core gently engaged so your back doesn't sag. Then return to the starting position and switch sides. Try to do 5 on each side if comfortable. This exercise helps build stability in your whole core. Please use a padded surface for these exercises if needed. If you have any knee problems, place a folded towel under your knees for cushioning. And if any exercise causes discomfort, stop and rest. The goal here is gentle, gradual progress. You don't need to do these perfectly or push through pain. Even a small effort counts. Over time, these little strengthening exercises may help your body feel more supported when you stand. Now, let's talk about something that many people overlook, and that's your environment, particularly what's on your feet and what you're standing on. The shoes you wear and the surfaces you stand on can make a big difference in how your lower back feels. Let's start with footwear. If you're standing for extended periods, supportive shoes are really important. Shoes that are too flat, too worn out, or too high can all contribute to back pain. Look for shoes with good arch support and cushioning. They don't have to be expensive, but they should feel supportive and comfortable. If you wear sandals or slippers around the house a lot, consider switching to supportive indoor shoes instead, especially if you spend time standing in the kitchen or doing chores. Some people find that shoe inserts or orthotics help as well. You can find over-the-counter inserts at most pharmacies, or you can talk to your doctor about custom options if you have specific foot problems. This is very individual, so what works for one person may not work for another, but it's worth exploring. Now, let's talk about standing surfaces. Hard floors like tile, hardwood, or concrete are tough on your body. When you stand on a hard surface for a long time, there's no give, and that impact travels right up through your legs to your lower back. One simple solution is an anti-fatigue mat. These are cushioned mats designed to reduce stress on your body when standing. You can place one in front of the kitchen sink, your workbench, or anywhere you tend to stand for long periods. They're affordable and can make a noticeable difference for many people. Also, remember what I said earlier about movement. Even on a cushioned mat, try not to stand completely still. Shift your weight, take little steps, march in place gently. Your body is designed to move, and movement helps keep the blood flowing and prevents muscles from getting stiff and overworked. If you have a task that requires standing for a long time, see if you can break it up. Stand for a bit, then sit for a bit, then stand again. Even small breaks can help. And if possible, consider using a footrest. Alternating placing one foot up on a low stool or step and then switching can help reduce some of the strain on your lower back. This is an old trick that people who work on their feet often use. Before we wrap up the main strategies, I want to address some common mistakes and myths that I hear a lot when it comes to lower back pain from standing. The first myth is that you should just push through the pain and it will go away. This is not good advice for most people. Pain is your body's way of telling you something needs attention. If standing causes you pain, that's a signal to make some adjustments, not to ignore it. Pushing through can sometimes make the problem worse, not better. Another common mistake is avoiding all movement because you're afraid of making things worse. While it's true that you should avoid movements that cause sharp pain, gentle movement is usually helpful for back discomfort. Complete rest and inactivity can actually cause your muscles to stiffen up more and weaken over time. The key is finding that balance between rest and gentle activity. I also hear people say that lower back pain from standing just means you're getting old and there's nothing you can do about it. This is not entirely true. Yes, some changes happen with age, and yes, you may not have the same stamina you did at 25. But that doesn't mean you're helpless. Many people find significant relief from the simple strategies we discussed today. Small changes really can add up over time. Some people believe that they need to do extreme exercises or intense stretching to fix their back pain. Actually, the opposite is often true. Gentle, consistent movement tends to be more effective and safer for most seniors than aggressive or high-impact routines. It's not about how hard you work, it's about doing the right things consistently. And finally, some people assume that if the pain isn't severe, they don't need to pay attention to it. But mild, persistent discomfort is worth addressing. It's often easier to manage a small problem before it becomes a bigger one. Now, while these tips may help many people, I want to be very clear about when you should see your doctor right away. Please seek medical attention if you experience severe back pain that came on suddenly and is intense, especially after a fall or injury. Please see your doctor if you have pain that radiates down your leg, especially if it goes below your knee or is accompanied by numbness, tingling, or weakness. This could be a sign of nerve involvement that needs medical evaluation. Please get checked if you have difficulty controlling your bladder or bowels along with back pain, as this could indicate a serious condition that requires urgent care. See your doctor if you have back pain along with fever or unexplained weight loss, and please seek help if your pain is getting worse despite rest and home care, or if it's interfering significantly with your sleep or daily activities. Trust your instincts. If something doesn't feel right, it's always better to get it checked out. There's no shame in asking for help. Your doctor can examine you, run any necessary tests, and make sure nothing more serious is going on. Let's quickly recap what we covered today. First, we talked about improving your standing posture, keeping your feet hip-width apart, your knees slightly soft, your core gently engaged, and your weight shifting occasionally rather than standing completely still. Second, we went through some gentle stretches for your hip flexors, hamstrings, and lower back that you can do regularly to help release tension. Third, we covered simple strengthening exercises like pelvic tilts, bridges, and bird dogs that may help support your spine over time. And fourth, we discussed your environment, including the importance of supportive footwear, cushioned mats, and taking breaks when you need to stand for a long time. Remember, you don't have to do everything at once. Start with one small change that feels manageable for you and build from there. Maybe this week you focus on practicing better standing posture. Next week you add one stretch. Small steps add up over time. Be patient and kind with yourself. Progress looks different for everyone. If you found this helpful, I'd be so grateful if you'd give this video a thumbs up. It really helps other seniors find this information too. And if you're not subscribed yet, consider joining our community. I share new videos every week to help you stay strong, healthy, and independent as you age. There's a whole library of gentle exercises, practical tips, and wellness information here for you. If you'd like to keep going, I recommend watching my video on simple exercises for better balance. Many people find that improving balance also helps with back comfort because you're strengthening the same supporting muscles. I'll put the link on screen and in the description so you can find it easily. Thank you so much for spending this time with me today. It truly means a lot that you're here taking care of yourself. Remember, your body has carried you through so many years and so many experiences. It deserves your patience and your kindness. Take care of yourself, listen to what your body is telling you, and don't hesitate to reach out to your healthcare provider if you have any concerns. I'll see you in the next video.